Hi, y'all. My name is Keira Adams, and today I'll be telling you guys all about my internship with Partners in Health through Harvard's Global Health Institute. So you might be wondering, who am I? I'll give you guys a little bit about myself. So my name is Keira Adams. I am a sophomore at Harvard College studying neuroscience and African American studies, also looking to do a little bit more with the global health and health policy secondary as well. And I'm from El Paso, Texas. And a fun fact about me is I have attended over 8 different schools. So I've moved around quite a lot. So what is Partners in Health? So Partners in Health is a global nonprofit health organization that fights social injustice by bringing the benefits of modern medical science to the first and foremost most vulnerable communities all across the world. So Partners in Health will go to various areas of the world and even work domestically as well to help advocate for what it means to have global health and what it means to have healthcare equity. So being able to provide a preferential option for the poor, and really being able to advocate for the communities that need it the most, regardless of sex, gender, socioeconomic status, or any other sector of life. So within Partners in Health, there's also the advocacy team, and also within the advocacy, there is Partners in Health Engage. So Partners in Health Engage is a constituency of high schoolers and college students and professionals as well that are across the United States that recruit, train, and equip dedicated members of volunteers who organize to be able to mobilize for their community in regards to the fight for healthcare equity. So what we had this summer is that we had an amazing conference, being able to bring over 200 engagers from across the country and even some people from international sectors and sites from Partners in Health Engage to be able to all come to Washington, D.C. to understand what it means to advocate for health equity and be able to talk about our campaigns for the upcoming year, which is in regards to advocacy, community building, and fundraising. So I was specifically working on the advocacy side of the Partners in Health Engage sector. So being on the advocacy team within the Engage sector, I was able to create resources to advocate for the eradication of tuberculosis. So I was advocating for the NTB Now Act of 2023, being able to direct Hill Day, which is a part of our major conference that we had this summer. So being able to direct over 120 congressional meetings for our members within Partners in Health Engage so they can speak to their members of Congress and how to advocate for the bill themselves. And also, I just learned so much about healthcare equity. So here is a glance at my summer. So in the first picture that you can see, that is at the conference. So we, like I said before, we had over 200 participants all come to Washington, D.C. So that in the middle is an example of one of the meetings that we had. So I was being able to work with other members that are from the DMV to talk about what it means to have healthcare equity and speak to those representatives. That's me on there. I had so much fun. At the bottom, those are my coworkers. So that's Kian and Emma. Emma goes to Harvard, and Kian just recently graduated from Trinity University in San Antonio. And we just had an absolute ball. So much fun. Thank you, HGHI, for putting me with these amazing people because I wouldn't want to have it any other way. And I could talk for days and days and days about how much I learned through Partners in Health. Like I'm repping their merch all the time. I love Partners in Health, specifically Partners in Health Engage. They're always doing amazing work. But I just wanted to give you guys a little bit more insight about all the amazing things that I learned through Partners in Health. So while I was working a lot with trying to understand the historical context of tuberculosis and why it hasn't been eradicated domestically. I mean, why it hasn't been eradicated internationally as how much it's been eradicated domestically. I learned a lot about how the modern effects of colonialism really do affect how we treat tuberculosis, especially on the other side of the world. And within that sector, also being able to understand how to form a relationship with Congress. As someone who would love to become a physician, my work cannot be as powerful if I don't have the legislation to back me up. So really being able to understand that there's amazing things that I can do with my hands, but I need to use my voice to be able to advocate for the people who cannot advocate for themselves. So just really understanding that. So as a pre-med, I never thought I'd do anything with legislation. I don't like to read. I don't like any of that, but it really did change my perspective of all the amazing things that I can do, not just within the healthcare, but at all the places it intersects, which is basically everywhere. So I also did a lot of work of understanding how I can combat structural violence at a structural level and also as an individual level, and working with my community to create the resources that are necessary to help anyone and everyone get through the times that they are going through, regardless if that's within healthcare or facing day-to-day interactions, and what I can do to advocate for other people. And also understanding that there is a huge fight domestically for global health equity. There are people everywhere who all just want amazing access to healthcare, and I just have to be able to be that person that can advocate for that. So understanding the resources, the unions, and different organizations that are also engaged with partners in health to understand what are all the amazing things I can do to advocate for health equity. And there's so much more I could talk about, but it's a huge thank you to Partners in Health, Partners in Health Engage, and also the Harvard Global Health Institute for the amazing work they did in providing me this amazing internship. I wouldn't have it any other way. It definitely changed my trajectory of my career. I definitely want to do a lot more with healthcare advocacy and really understand what it means to have equitable healthcare. So shout out, y'all. Everyone's amazing. Everyone's great. And you guys really did change my life. And I'm forever thankful for this internship.